I've seen arguments that say puberty blockers are linked to bone loss. Most kids go on to hormones. They can cause infertility, and stopping puberty can cause permanent damage to the body. And if you hear all of that at once, it sounds terrifying, which is exactly why these conversations get so heated. Because when medical topics get compressed into a paragraph, risks, myths, and half-truths all blur together. So instead of arguing, let's slow this down, not to defend anything, just to be precise. Because puberty blockers aren't magic, and they're not harmless, but they're also not the horror story people imagine. And the difference matters. Before we even get into the science, I want to clarify something I have said in previous videos. I've said puberty blockers don't change anything. They just pause puberty. And I can get why someone might hear that as misleading. Because don't change anything can sound like no effects at all. That's not what I meant. What I meant is they don't introduce new sex traits. They don't cause transition by themselves. And they don't permanently alter the body. But pause doesn't mean zero effects. Like any medication, there are side effects doctors monitor. So the more accurate way to say this is puberty blockers delay development rather than redirect it. That distinction matters. Puberty blockers aren't transition drugs. They're medications that temporarily suppress certain hormones. They've actually been used for decades for things like precocious puberty, or kids starting puberty way too early. This isn't new medication. It's established pediatric endocrinology. Organizations like the Endocrine Society, the American Academy for Pediatrics, and the WPATH all describe them the same way. A pause button, not a decision button. No surgeries, no cross-sex traits, no permanent changes. Just time. Time to think, time to evaluate, time to avoid changes that can't be undone. Now let's talk about the first real concern, bone density. This one is legitimate. While someone is on blockers, bone mineral growth can slow. But here's what usually gets left out. Bone density typically catches back up once either natural puberty resumes or hormones are introduced. Doctors already monitor this with scans, so it isn't hidden damage. It's a known, tracked side effect. And this is how medicine works in general. There's almost never zero risk. There's just, is the benefit greater than the risk for this person? That's what doctors evaluate case by case. Next is the statistic you will see a lot. Most of the kids on blockers go on to hormones. And that sounds like blockers cause transition. But that's backwards. Blockers aren't given randomly. They're prescribed to kids who are already persistent, consistent, long-term dysphoric, and evaluated by specialists. In other words, kids who are already extremely likely to continue. So of course most continue. That's not the medication causing it. That's selection. It's like saying umbrellas cause rain because everyone using one is already in a storm. Older desistance studies get cited as well, but many of those counted kids who are simply gender nonconforming, not actually dysphoric. So the numbers get inflated fast. When you compare like-for-like patients, the dramatic percentages shrink a lot. Then there's fertility. Blockers alone don't cause infertility, but long-term hormone therapy can affect fertility. And that's important, which is why clinics talk about it ahead of time. Things like sperm banking, egg preservation, waiting. These aren't surprise consequences. They're planned medical conversations. Just like with chemo or other treatments that have trade-offs. Because again, medicine is about informed decisions, not pretending risk doesn't exist at all. You might also hear claims that blockers permanently ruin surgical outcomes or cause extreme complications later. This gets repeated a lot online, but it's exaggerated. If puberty is paused very early and for a long time, genital development may be smaller. Surgeons already account for this. Modern techniques don't rely on one single method. But here's the bigger point. Surgery isn't even relevant for most kids on blockers. Most never have surgery at all. So describing every child's care using worst-case adult surgical scenarios isn't realistic. It's like describing braces by talking about jaw reconstruction surgery. Technically related, practically misleading. So what are puberty blockers really? They're not harmless, but they're not catastrophic. They're a medical tool, used carefully, monitored closely, for a small group of kids already struggling. And the alternative isn't nothing happens. The alternative is forced puberty, which also has permanent effects. This isn't a risk-free option. There's just which path causes less harm. That's the real medical question. Not fear, not internet math, not viral comments. Just careful individual care. So, when someone says puberty blockers either do nothing or destroy lives, both are oversimplifications. And oversimplifications are where misinformation grows. The reality is quite higher than that. More boring, more medical, and a lot less scary than people make it sound.